We all good?
Yes, sir.
All right, let's open the Scituate Board of Health meeting, Selectmen's Hearing Room, Monday, October 21st, 2013. Take a motion to accept the agenda, or did we amend the agenda? Is there...
We amended it to the date and the fact that our next meeting date cannot be the 4th because of town meeting. So we'll have to check the availability of meeting space and then email you for your availability for a meeting.
So leave that to be determined.
Yes.
All right. Fair enough. Is there a motion?
Yeah, I'll make a motion that we accept the Board of Health meeting for Monday, October 21st, the amended agenda to reflect the next meeting not being October 4th because it's town meeting, as well as November 4th.
I second.
All those in favor?
Aye.
All right, we get approval of meeting minutes. I guess we can go through them one at a time. The first one is July 29th, 2013.
I'm all set on that. Steve, all set on that? Yeah, you on that, right? No, you are not. July 29th. And yes, you are on that.
I think I saw one thing, and I'll start while y'all looking, and I'm not sure if it's just clarification. It was just something in here.
What page are you on?
Page 2, in the 710 public hearing for 272 Central Avenue. It's very simple. It just said, explain the tank would be enclosed in fiberglass, or was it to be made of fiberglass? I thought the tank was to be made of fiberglass.
Yeah.
Okay. So it says enclosed in fiberglass, so I think that's just a minor change. And I think that's all I had for those, so just with that change. Unless anybody else has any changes to July 29th.
I do not.
I do not.
Have a motion to accept the meeting minutes for July 29th, 2013.
Make a motion to accept the July 29th minutes.
Second.
All those in favor?
Aye.
All right, we'll move along to August 12th, 2013. I'll start. I had no changes. They were okay from what I read. Are there any other changes, additions, corrections?
No.
On August 12th?
Yeah.
No. So I make a motion to accept the minutes for August 12th.
Second.
All those in favor? Aye. August 26th, 2013.
So the 26th and September 11th, I did not review.
Okay, and I was not present on August 26th, so I cannot vote on that, so we'll put a hold on August 26th.
Okay.
September 11th, 2013. Have you just stated you? Okay, I had, we can hold on these two, but while we're sitting here, I had one minor spelling correction on page 3. It's 1, 2, the third paragraph down with Al Reardon, and he stated the whooshing, I think it says wound, I think it meant to say sound. So, minor, like I say, just,
The next one I wasn't at. September 23rd, I was not at.
okay, all right, so we have a hold on September 11th anyways. And September 23rd, you weren't at, are you?
Yeah, I'll sign that one. So I make, do you have any changes?
No, they were okay with me too.
So I make a motion to accept the minutes for September 23rd.
Seconded. All those in favor?
Aye.
And the last one we have is October 7th, 2013. Again, I had just a minor spelling correction that I saw. It's on the first page, the last paragraph down. It says he, and then it says S.E. stated. It was a lot of hard work on Mr. Dowding's
I saw that today, yeah.
And then that while we're right there, the line above that, the cost of $800, I believe that was per event.
Per testing.
Per, they call it event then.
Yeah.
Yeah, so we can add that in. Any other changes, corrections, additions, subtractions? I was pretty good with that too, that was in the minor thing,
Okay, so I make a motion to accept the October 7th minutes.
Aye, second?
All those in favor?
Aye.
All right. Job well done, Mary, thank you very much.
Yes,
It was a lot of work, and,
We're all caught up.
yeah. All right. You ready, Jennifer? We'll move right along to 7:10 PM. All right, 7:10 PM, definitive subdivision plan, Blanchard Farms Estates, 40 Curtis Street. Greg Morse of Morse Engineering, representing applicants John Barry and John Tedeschi.
And Greg is here with Jeff Hassett from his office.
Yep. Good evening. The reason why we're here, I guess we've submitted a definitive subdivision plan. This property is located at 40 Curtis Street. It consists of 10 single-family lots, one of them being the existing house. This is in the residential 20 district. All of the lots comply with the 20,000 square foot area requirements. It's accessed via a new road. It's approximately 600 feet in length. Over the summer, we conducted perk tests on all of the lots. We have a minimum of 4 deep holes and 3 percolation tests per lot, as you see it. Lot 1, which is the existing house, will be a simple septic repair for that project. All of the other houses have been designed to fully comply with new construction standards. There are no wetlands on the property. It's been before the Conservation Commission, and they've determined no jurisdiction. It's currently before the Planning Board for subdivision review. We have not met with them yet.
I'm just curious, I mean, are you just looking for a straight subdivision, or is it any type of open space plan? Or just-
No, it's a straight subdivision.
This is land that belonged to Dr. Blanchard, a longtime physician in town, and his family. And the front of the house, I'm sure you recognize it if you went down Curtis Street. It's a big brown 2-story colonial garage. And then this land is in back, and it's between that and Woodyer Drive, and a lot of it was used agriculturally for a number of years. Why don't you go to the next page, and I'll explain a few things on my end.
Is this a conditions plan or moving on?
From my review. Okay. I'm making out slightly better on yours than mine in lot 7. There's something up here that he did, but I can't quite read it. It's a matter of having all the lines in the printing, and, you know, I'll be able to figure it out a little bit later. But he's got 3 drainage areas here. And, you know, I'm pretty much satisfied that we have substantiated the number of perk tests and test pits that we need with satisfactory results, anywhere from 2 minutes to 59 minutes an inch. But the concerns that Jeff and Greg and I have discussed is that we've got a water line that's going through the reserve area here, and there is room that it not go through the reserve area, so I would suggest we avoid that problem at the beginning rather than later down the road.
Jeff, nothing for nothing. Can you bring that plan down on the table?
Okay.
We're still in here for this, so I guess you got your captive audience right here at the table, so.
We were expecting an abutter or two, but
Yeah, then, oh, that's cool. Oh, I appreciate it, but.
Okay, here's the water line. He's got to go
Thank you.
through the reserve area, so there's room to go around, so that's what we'll have him do. You know, I need a little better translation here between all the lines, but that can be accomplished. We have an abutter who came forward to me already about this, and they have concerns about the drainage and concerns about, mostly because of the mosquitoes which, you know, is a real risk these days when we have to design drainage areas. But Jeff and Greg have addressed that, and they will tell you about it. And then some of my concern is the way we have these slopes down to the back of yards. Now, I understand that there is a slope already, but in some cases it's not maybe as pronounced. However, I have also talked to Jeff and Greg on this, and they will address this in their presentation as well. What they have done that should lessen it. Is this in fact going to be stayed as a foliage buffer?
That's the intent.
Okay.
This portion is in the drainage parcel, so assuming the basin doesn't change throughout the review process, this will be preserved.
Okay.
These areas, it's a 20-foot buffer in the backyard, which we don't have a deed restriction saying they can't clear that 20-foot, but the intent is to encourage the homeowner to maintain a vegetative buffer. The drainage calculations
help.
are, for doing the drainage calculations, we assume that the entire property would be cleared in the post, so it's conservative.
When was the last bond? When was the whole?
This summer.
This summer?
Yeah, we actually had to wait for them to harvest the corn before giving
This is
soil
John Tedeschi,
testing.
one of the applicants.
Okay, so should we be worrying about pesticides or anything in the ground?
Not,
Nothing?
No,
Not
because
right
most of
now.
it would have dissipated.
Okay.
Yeah,
I
and,
would think.
just,
As far as drainage, currently the property, the high point in the property is about these houses here. And the rear yards grade back, and it's a moderate area, gentle slope throughout the cornfield in this area. And it all flows this way towards Whittier Drive. If you walked this stone wall along the property line, there's a very gentle swale. It's a little bit lower this side of the stone wall. So we designed it with two design points in the existing and the proposed. A large portion of the property grades this way to kind of this area here. The larger and the majority of the property goes back this way to this corner. So the way we laid out the drainage is we have a closed drainage, catch basins and manholes directing the runoff to this point to a subsurface infiltration system. Up to this point to an infiltration basin. And then going back this way, we're diverting it to a swale, a sediment forebay, a constructed stormwater wetland, and then an infiltration basin. For the overflows for these, that is the emergency spillway, which even in a 100-year storm won't see any flow. The primary outlet goes here, and we're doing a level spreader for the longest distance we can to kind of dissipate that flow over a large area. And we're doing the same thing over here. So for mosquito control, the infiltration basins and the subsurface, these three, are designed to infiltrate within 72 hours, which is the requirement as far as DEP. The DEP does recognize that in a constructed stormwater wetland, it is wet and there could be mosquitoes there, and they have a whole section on how to handle that. The reason we're doing this type of basin is it is the preferred type. It gets the maximum treatment. So some of the measures we're taking is we're creating a habitat for species that feed on mosquitoes, bats, birds, dragonflies. We're doing that by bat boxes around the property. And on our planting plan for this, we'll create habitats for those species. The other things that they mention are applying larvicides if necessary. And if that's done, it has to be done by a licensed applicator.
And of course, any of these people have the ability to call Plymouth County Mosquito Control
Absolutely.
in the summer, spring and summer.
Can you actually get larvae, dragonfly larvae, and put it in the water?
I don't know, but that's something we can look into.
Yeah.
one of the unique things in designing this drainage system, typically you're going from a forested condition, now you're converting it to lawn, or you're converting it to impervious, and you're getting an increase in runoff. Where this is barren soil the majority of the year, the simple fact that you're planting grass actually reduces the curve number. That's a huge reduction in impervious just by applying vegetation. I mean, we're talking a field here that's substantial in size, 5 to 6 acres of bare ground right now. So, the drainage calculations, document, again, the pre and the post, and those are being reviewed by the planning board's review consultant.
The other improvement is right now, everything from, all the flow from here is going this way. And in the proposed conditions, we're grading the front yards up a little bit so that it'll be captured and diverted back into the basin. So really, the only drainage area going directly this way is now the backyards.
And by maintaining that buffer, that should help, and the fact that we're bringing in, some quality fill that should be pretty absorbent should help as well.
All the perk tests, they do support Title V.
They do,
System.
yep,
On each lot.
on each lot.
Yeah, he might have to do a couple.
Couple extra ones, like on lot 7.
Yeah, but there's no reason to believe, since they've already got good ones in the area, and they just need a couple more, that they won't get them.
Yeah, pending final house configurations and stuff.
And remember, the drainage can be altered once things go to planning board. But whatever ends up the final copy, we'd like on clear.
Of course.
Okay.
So we're working apples and apples.
Okay.
The other thing is since I imagine there'll be a homeowners association, I think that we will make it a condition of approval that the homeowners association make contact with the town once a year for a liaison person that we can be in touch with, give us the contact info. Because people change and we don't go around neighborhood to neighborhood keeping track.
Yep.
But, if you need to get a hold of somebody, we'd like to have that name and the phone number. So
Is the
we are
intention of this to be
tackling
a private road, or is it eventually going to be a public road?
We'd love to see it a public road, but I don't think that the planning board will. And it'll probably remain private. I mean, that's what they're calling it, it's been lately. Yeah, if you put language in there, it'll remain private forever and ever.
Which isn't enforceable.
No, I find that a bit bizarre, actually. Every other town that I build developments in.
Well, if you build them by the regulations.
If you're building the rules and regs, the town can vote and bring it to a public way at that point.
And this is a no waiver plan.
Yeah, we're not asking for one waiver on the whole.
I think there was somebody had with
That
a,
might be a first.
Yeah. I'd love to ask for a longer road so I could get another lot or two, but we're not gonna bother, because that's another one that they've just put their foot down and said no more longer road extension, so,
path of least resistance.
Yeah, well, that's what we're going for, and,
I only asked because I think we just had a subdivision and they had the mosquito thing, and we were gonna say to let the homeowners know that they can spray it, whatever else, so.
Yeah, we put,
Pointed out having a contact person, that was my only
I don't have any.
reason for asking that question.
we put together an operation and maintenance plan that
think
was
that's
submitted to
what
the
we
planning
did
board.
on the other one. Exactly.
Yeah, and we included a section on it.
Okay. That was recent, try to keep it consistent.
sure,
Yeah.
makes sense.
I don't have any further question, I'm good.
No, big motion?
No,
I have a motion that we approve the Blanchard Farm Estate Plan for Curtis Street, according to the North Sun plan.
A second?
All those in favor? Aye.
Great.
Thank you very much.
All right, thank you.
Got appropriate t-shirt on for this evening. Yeah. Thank you very much. Enjoy the evening.
Thanks.
Bye-bye. Take care, folks.
All right, 7:20 PM. DJ Wilson, Tobacco Coordinator for the Mass Municipal Association, to address the board on tobacco rules and regulations and compliance.
Hi.
How you doing?
Good, so.
Excellent, excellent.
So,
Steve Russell Mike.
and I've been at Mass Municipal Association for 19 years doing this. We've worked before on this. And helping cities and towns with tobacco policies.
government agency?
Mass Municipal is a trade association for municipalities, so our subgroups are, that matter to you. We have a Mass Selectmen's Association, and we represent town and city managers as well. Scituate is a dues-paying member of the MMA. So I help cities and towns with policies, and so it's very routine that go around, and we have a lot of cities and towns that have older policies that try to update them. So what I was going to go through tonight was I don't know how much time you want me to just keep on prattling, but I'll try to go as fast as possible.
Okay.
Don't worry
So-
about it, do your thing.
Okay, all right. Okay, all right.
I want to learn, I'm not here for a speed edition.
So what ended up happening, what's happening over the years is that we used to sit, at the time that your original policy was done, we would sit and we would go through them all and review every single one of them. And we've gotten much more efficient about the way we do things. So here are two handouts. One is a list of what cities and towns are doing statewide on hot topics that we'll go through. And the other is a sample regulation for sales. We used to call it youth access, but there are some things in there that go beyond just youth access. And did I attach? No, that's it. So let me tell you where we start. So you're an unfunded Board of Health, which means you don't get DPH money to do compliance checks, so that is an uphill battle for you. But we do have cities and towns that do compliance checks, even though they're unfunded. And but this template came about as it's kind of the state of the art of what we do for cities and towns. So you'll see on the front page is a checklist, and I'll probably just go down the checklist quickly. So the things that this top section here, what it references is this kind of pushes together best practices, make sure that it at least meets the minimum US FDA standards. There's two regulations out of the Mass Attorney General's office, so it has to meet those as well. And then a lot of practices that come out of Boston. They just, they're lucky enough to have a public health department that has their own legal department, so they're willing to be our guinea pig a lot of times, so that's good. So, and then the process is, if you want to go ahead and update this regulation, you can do the checklist. I can actually do I can do the draft up for you. I'll look against your current regulation to see if there's anything in here worth transferring over, though a lot of it may already be mentioned in the new one. And so that's how the process works. So the first big thing that we've done is everything makes this more cumbersome because we're going to start using the term nicotine delivery products. So the number one thing that we've seen out in the market that is the most viable nicotine delivery product according to the regulation are electronic cigarettes. I have a whole bag of stuff. I hope I do. I left it in the car. That's all right. This is good enough. So in the time I've been doing this job, we've had 2 instances where we saw nicotine lollipops and 2-liter bottles of nicotine water on the market. They came and went off the market pretty quickly, so by the time we had any concern about them, they were gone. But one of our concerns was, even though they had they're a manufactured product with nicotine that could be addictive, they didn't fall within a regulation, but they came and went. But these actually fit the same regulation. So we have this wonky term, nicotine delivery products, that doesn't contain tobacco, it's manufactured with nicotine and not FDA approved. So it doesn't include Nicorette or the patch. So if it's been approved for cessation, it's not part of the regulation. So electronic cigarettes, and I was one of the people who in the beginning were like, that's nothing to be worried about. They started out, the one I have in the car, it looks like a regular cigarette. It was $70, it's rechargeable. And you would screw this part off. This is the battery, and this is the nicotine solution. Comes in different strengths, and this one comes in different flavors, and obviously has a nice packaging to it, doesn't look like a cigarette. So we were like, oh, no kid's gonna buy this for $70, can menthol and plain, no big deal. But they got cheaper, so this is disposable, this is $8, and depending on how it's hard for me to tell you how, they'll attest that it's 300 puffs or 200. it's hard to know that because you use these differently from a cigarette. So it's actually,
Between disposable, so it's not.
yeah, so this is no good when the battery dies.
What's the cost of that again?
About $8.
$8.
So the rechargeable ones you either do with a USB port or you charge right into the thing, and that you change these. So some of our concerns are that they've moved away from, they've never been able to say that they're a cessation device, but they could be the best cessation device ever because it meets both two things. It gets, if you really wanted to quit, you could taper down on the nicotine on these, and that was my second thought. Oh, and that you're getting at least, you know, something in your hand that feels like a cigarette. But the problem is that we now are reaching a critical point in these. This is strawberry flavored, so they come in a lot of flavors. They're disposable. They're cheap. They are cheaper than a pack of cigarettes, and the big tobacco is getting into the game. So Laura Lard bought this company called Blue, BLU, and you'll probably have advertising on the front of any convenience stores in town with that word. And then R.J. Reynolds and Philip Morris are developing their own. So so now this is a big concern of ours, because this could be the entry point. While it could be the best cessation device for current smokers, it could also be the reason a lot of people, and mostly kids, start into nicotine addiction. So that's why we now care about it, especially with the big companies coming into it. CDC did a quick study and found that over the course of 1 year, our surveys indicate that the number of, it's a low percentage of high school kids have tried this, but it's doubled in a year. So, and then the other problem that we also have with these is the ones that you can screw off and replace the cartridge. If you go on YouTube, you'll see, God, I have everything in my car.
If you want, you can take a minute and get it.
Maybe I will, and have Jackie. And Jackie can introduce yourself.
I got lost in the parking lot. Are you going for e-cigarette?
I was gonna go for my whole bag of stuff.
Oh, well,
Oh, she will. Come on up. I'm sure we all carry about the comparable thing.
You talked about the 200 to 300 puffs. Any idea what a cigarette, how many puffs is considered in one cigarette?
I don't know, but see, and that is the problem, is that they smoke a little differently, but as you well know, smokers kind of consider themselves a half a pack a day smoker. I only smoke 4 a day, or, you know, that's how they count it per unit, but there's no equivalent. So one of the problems is if you become a dual use, which is the maximum way for the industry to make money, is that you would use this inside here and then smoke a cigarette outside. But in reality, you could end up being more addicted to nicotine because you are actually getting more nicotine from
You have
this
the
than you
access to
think
the
you
engine.
are. Yeah.
And you can be inside too, as
Right.
opposed to getting up and going
Right.
outside, so.
So one thing that she doesn't have, let me just finish the sentence and we can start pulling out your stuff, is that I did buy, you can buy little vials of nicotine online. I got cotton candy, sweet tarts, and bazooka gum.
Which obviously.
So you can fill this yourself, and more importantly, if whatever you can basically boil on your stovetop, you can put inside the cartridge. So, and there's YouTube capacity to find out how to make THC into a liquid and put it in one of these. So our concern is that we don't want people using that, but we also don't want to have the, 5 of us sitting at a bar and I'm using one of these and you have no clue what I filled it with. So that's a long story around electronic cigarettes and nicotine delivery products, but I bring it up because it ends up getting filtered through a lot of this regulation. So it expands your permit, vending machines, self-service display, all that kind of stuff. And your retailers would be able to sell to kids if they got caught, they'd get the same penalties. So it's really treating it the same. So that's the first thing that this regulation does. And you'll see on the first list of cities and towns, these are the cities and towns these 86, that's probably close to 90, I just don't have some final regs in my hands to add to the list. These 86 treat electronic cigarettes like tobacco, and 44 of the 86 also say, and this is a separate regulation that we can talk about or not, that added to their secondhand smoke regulation, saying you can't use an e-cigarette wherever the state's smoke-free workplace law extends to. So you couldn't use it here. You just step outside and use it like a cigarette. So then,
That's regulated by the what, by the DPH?
no, this would be a local regulation.
No, the current, you can't smoke inside.
Currently, there's no state law. There's a state bill. Oh, yeah, so the state has, it's gonna be 10 years old next July.
Yep.
You know, no smoking in restaurants,
That's
bars.
the DPH.
workplaces. That's a state law.
State law.
Yep. There's a DPH regulation attached to it that further refined some questionable language about outdoor spaces, private clubs, and something else. I can't remember what the third thing is. But it is a state law.
And the ones with the asterisks, they've adopted that exact same.
They've said, basically the regulation said, the draft says, we enforce the state law, but we recognize the state law as anti-preemptive, which means cities and towns can go further, and we ban the use of e-cigarettes wherever the state law,
State law
and
applies.
this regulation applies. Yeah.
You have a question?
Yeah.
Are you saying that it's up to the local board of health to enforce this e-policy, this e-cigarette policy? Or is it gonna all fall, like, to follow on Mike's point, is it gonna follow the way it is?
Well, if you choose to, you don't need to, but there is a state bill. I have no clue. There was a hearing on it. I have no clue what its success will be, but we have about 14 states in the country that treat electronic cigarettes like cigarettes in terms of selling them to kids. So the state may eclipse this, but at this point in time, it's legal for, you know, a 13-year-old to buy an e-cigarette in Scituate. And it's legal to use an e-cigarette right here, so.
So nicotine's not,
Right, so that's why we need to do this, because it doesn't contain, your current regulation just deals with tobacco. It hasn't, you can argue
So
that,
any age you can
you can
have- you can-
argue that your nicotine gel was derived from tobacco, but it's not a legal or laboratory fight that you or the state wants to get into. So that's the biggest part, that's the biggest change to our regulation, is that it did that.
what's nicotine considered? Is it considered a drug? Is it considered?
It's actually considered a poison as well. It's used as a pesticide in a lot of instances.
I mean, some of the reading I've done is one way or the other with nicotine, but I just wasn't sure of the status of it. If it's a drug, but like you said, if a 13-year-old
It is
can
a-
buy it, then it wouldn't be a drug regulated by,
Right.
it's like bubble gum or anything else, you just have it, but, or coffee, I guess coffee, a 13-year-old could buy a coffee, but a parent wouldn't let them have the caffeine.
If they,
What's the FDA's, where are they in all this? It seems
Well-
like that they're a little behind the curve here.
they always are. We've never been able to rely on the federal government to get, the federal government has never been ahead of us on anything in tobacco. So, and seeing that the FDA just reopened their doors a few days ago, they're supposed to, by the end of October, decide if electronic cigarettes are to be treated like tobacco or not. That'll just, then they'll give like a year's worth of time for people to chime in if they think that's a good idea
I
or
was
not.
on the NTA website today reading some of the stuff, and
Yeah.
some of the case studies just look from 2009, 2010, so.
Right. So once they do this, and we think that they will, but I don't know if they'll stick to that timetable, it'll be a battle of the industry versus, you know, public health
Right.
on it. So we are getting ahead of the federal government on this. Getting back to your point about nicotine, I will say one thing. That, you know, nicotine, you know, it has calming effects. It does change the way your brain works. And so that's what keeps a person going back to a cigarette. But the real public health problem is what's in a cigarette. So the dirtiest delivery device
Is the
for
cigarette.
is the cigarette.
And
So
that's
we
kind of
may-
what gets me with the public health was the secondhand smoke. What you do to yourself is your choice,
Right.
but what you're doing to the people around you that don't have a choice, that's
That was right.
kind of the balance is in my mind.
Right.
But I can't see a 13-year-old person purchasing or using one of those. That just seems wrong
Using
in my
one.
mind.
Oh, yeah.
Exactly.
So-
That seems wrong. But it comes down to now, where can you use them and how do you regulate them?
Right.
And what's right and what's wrong.
Yeah.
Um,
So let me just say, you know, if you walked up to a doctor today and you know, if you said, would you rather your patient be on Nicorette gum the rest of their life or cigarettes, Nicorette gum? Would you rather them to be on this or cigarettes. They'd probably say, well, this, is, as long as I know that the gel is not killing them. But right at the moment, these aren't regulated by anybody, including the federal government, so that's what our concern
What have
is.
we learned about the vapor that gets exhaled?
It's unclear, I mean, it's just really unclear to know. It probably is safer, but because it's unregulated and that people could fill the gel themselves, a lot of the gel comes from overseas at this point in time. I think when the other two manufacturers get into the game, that won't be so true. But, so right at the moment, we don't know what someone exhales. So our thinking is, seeing that most adults who would be sitting at a bar probably have smokers who switch to these, they've already been forced to go outside for the last 9 years to smoke a cigarette. So if they need to use this, they can just step outside and do the same. So that's where we are on that. So number 2 on this list, well, before I go any further, I should let Jackie introduce herself. It's like this mystery person who just brings products.
So I'm Jackie Doan. I'm with the Tobacco Free Community Partnership Program. I'm based in Quincy out of Bay State Community Services, but I cover a large region of communities, including Scituate. So I am here. Our program is mostly prevention, and we're funded by the Department of Public Health. And that's it.
So she can give ideas on how to best roll this out between the two of us. We can help.
And any media support as well, if you're interested in covering this through the public and getting messages out about the policies.
Well, you are on cable right now.
Oh.
Yes.
Well,
So going back to this, so the second thing on the checklist, number 2, is the cessation sign requirement. So right now, retailers are required to post a sign. That sign is free for you to get from the state's clearinghouse. And for like the last decade or so, maybe not quite that long, Boston has required a separate sign that gives the quit line number, which is our 800 toll-free number for telephonic counseling. And that sign is also, you can make that a requirement for retailers, and that sign is also available free to boards of health to hand out. The third is a separate sign if you sell e-cigarettes, just as a reminder that e-cigarettes are not to be sold to minors. Not only do the customers may not know that, but the clerks also may not know that they can't sell them to kids. So that would be a good reminder. So saying yes to all.
Can I just ask about an umbrella question that you
Sure.
sort of brought up before? What is the enforceability and the legal status of that? Like, has that been challenged by, could be a Walmart, or could, has a major retailer?
For cessation, for the signage?
Well, for the prohibition
Oh, for the prohibition of
of selling the cigarettes.
e-
It's fine, has that been?
Well, first of all, it's
challenged
not a prohibition on the sale of e-cigarettes. It's just saying no sales to
by-
minors.
Okay, and
That's a big difference. Trust me.
has any of the major retailers challenged that?
Not e-cigarettes, no. So our earliest, I would say our earliest policies on cigarettes are probably 4 years ago.
And do any of these retailers, cater to kids of Forever 21 or Holliston, do any of them sell?
No, but they could. So that is one of the reasons that this percolated up, is that we were having, how these started getting sold was kiosks in the mall, and sometimes you'd have retail stores that didn't sell cigarettes but only sold these. So they were, so they were not permitted. They were allowing people to try it. There were sanitary code issues, because then that's how it all started. Holyoke was the first. He's like, people are complaining to me that they're just letting her try it, then they're letting you try it in the mall. So I would say it's drifting towards tobacco vendors also selling these, and especially when Philip Morris gets in the game. Philip Morris will probably say to their vendors, if you're going to sell our cigarettes, you're also going to sell our e-cigarettes. But we do now and then have these odd places out there that sell just e-cigarettes. So, things that get into this sample, if you used a traffic light kind of system, there is green as we, legally, there is green as we can go, but I can't guarantee that you won't get sued. We don't put the things that are red, and we are constantly trying to figure out when things go from yellow to red or green. And we'll talk about, I can talk about, if, at the end, if you want to footnote this mentally, I can talk about upping the age, minimum age, and flavored other tobacco products. Both of those are kind of are in our yellow bucket right at the moment. So what's in our red bucket is probably to ban e-cigarettes altogether. So those are the, so number 2 and number 3 have to do with additional signs. Number 4, no permit renewal if outstanding fines exist. But you may already have that town-wide. You know, some towns have this kind of synergy amongst the departments that say, you know, you're not going to get a building department if you owe a fine on your retail food permit. We're not going to give out a liquor license, or not a liquor license, but, you know. But, so that's usually a good thing. And it's just, but basically what it's saying is, well, the reason it percolated up for us originally is that we would have, you know, I would be up for my third, a $300 fine and a suspension, and I would quickly sell my store to my sister for $1 to get out of this. So this says, doesn't happen until everything's done. Number 5, this is something that's more edgy, and it's capping the number of permits. Let's see what I did here. If you go to the back side of the state list, is the cap. So we now have 18 cities and towns that basically took their current number of retailers and did this kind of informal equation with it and decided that we're going to just have this many from now on. The language is written so that your current retailers can renew as long as they renew within, I think the language says 30 days of your renewal date. And also, there's a provision that if I sell to Jackie, she has 60 days to kind of capture my permit, so that doesn't put my business at a financial disadvantage, not being able to sell it if you were at the cap, and a buyer couldn't get that. So this is the purpose for this. The rationale behind this is a slow, steady decrease in the density of places that sell tobacco, based on the kind of the liquor theory that every city and town has a formula that the state uses, and we generally, in all cases, have many more tobacco than we do liquor vendors. So that's something to think about. Number 6 is a big one. Let's see what she has in here so we can. Blue, actually, she has a blue. So blue is owned by Laura Lard Tobacco. I'm gonna take it all out, even though you have it nicely put in
Oh,
here.
that's fine. Cramped them all in there.
So, 2 years ago, the city of Boston got a huge, under the ARA, it was federal ARA money, they got a huge grant to do really edgy policy on something that they felt was really pressing in the city of Boston. And their survey showed, as well as ours statewide, that starting about 2 years ago, the surveys that we get from kids in the YRBS, that's done in the high schools, was showing that kids are using more cigars than cigarettes. And in fact, kids were being asked, do you smoke? And they'd say no. And then they'd be asked, do you use Black and Milds? And they'd say yes. They weren't even considering this smoking. This is a filter-tipped cigar made by a company called Middleton, but the company has since been purchased by Philip Morris. And this goes for 59 cents. It comes in plain, wine, vanilla. Maybe
That's it. That's all I see.
So Boston decided to take this policy from Baltimore and institute it. So what it says is, so what Boston and it's the second to last page of the cities and towns that have this policy, and the policy's on the bottom if you want to. It's easier to look at this. All this language that's on these lists is in here. So what they said was, so they recognized that all smokers are price sensitive, but especially kids. So what they said is that if you, any of these things that you sell singularly have to sell for at least $2.50, even if it says 59 cents or 99 cents. This is $2.50 in the city of Boston. And in all these, and in the other 29 cities and towns. If you decide to, but you can sell a 4-pack, this happens to be a 5-pack, but you can sell a 4-pack at market rate. And so it's under the theory that this sells more than $2.50. We knew the day would come that some cheap cigar company would come out with a 5 or 4-pack for 99 cents, and they have. So we have language, I would say, the 4-pack also has to be at least $2.50. So the reason for this is just that kids are very price sensitive. And so at the beginning when Boston put this in place, it's been in place about 1.5 years in Boston. They haven't been sued. There was lots of retailer confusion. So we put together a toolkit for retailers and for cities and towns to get them to better understand it. So while Boston handed out a lot of citations on this, I think other cities and towns have had a bit easier go at it now that Boston went into it. That we learned from Boston's errors. Anecdotally, about half the retailers in Boston have gotten rid of the single stuff and only sell 4-packs and bigger, and the other half have kept the singles and are making a mint off of them by selling them for at least $2.50.
So the retailer keeps the extra profit? Or is
So
that
you
tax?
get, I mean, I don't know what they get this for, but let's say 30 cents. So,
Not even,
right, so the keeping.
What kind of smell does it emit? Whatever smell it is,
Yeah.
whatever it is.
So let's,
That one might be a little older.
this does, I've tried. Huh?
It might be a little bit older.
It's just, you can't tell it's strawberry.
It's not as pungent as a cigarette. I mean, you can open that if you want.
You have a lot of strawberry, is that your,
I
is
know.
that your flavor?
I'm a girl, so I'm drawn to the pink.
So let me ask you a question. Did you consider that a success that half the stores stopped selling them?
Well, we consider, that was just to indicate, well, it was interesting to us actually, because it indicated that some stores, it was very important for them to sell single cigars, but they could get $2.50 from their client base. And others said, no, I'm not gonna, I'm done playing with single cigars. I'm good to get rid of these kids out of my store, and I'm only gonna sell these. But now that everything's settled down, they have good compliance, so it does mean that kids can't get their hands on a 99-cent cigar. Right now, Boston's in the process of fixing that minimum price.
But aren't they also governed by the sale to minors?
They are. And so this is, yes, so this is one of the policies that makes us change the title away from youth access to sale of, because it does affect adults too. And that's what the other side will say. But I have a customer who comes in every day and they buy this Splitterino, I don't know what this is flavored, but they come in and buy one cigar every day.
I didn't buy that as a whole. Those are all different.
Oh, yeah, I'll put them
You
in.
just gave me the pack.
And that'll hurt my business. I mean, our argument is number one, to go after youth and make the price high enough so kids are dissuaded from buying them. But it's also not a bad goal to have adults smoking less too. So, but it is something that affects, there's about a few policies in here that are aimed at kids but do affect an adult population as
When
well.
you say kids, what do you mean by kids?
Under 18,
They shouldn't be buying them anyways, right?
correct.
Yeah.
But our surveys indicate otherwise. And I will say that if you did when we do
So it goes
compliance,
back to compliance checks, when all the taxes went on tobacco products, probably 10, 15 years ago, that money was supposed to be slated for advertisement and compliance checks,
yeah.
and it's gone now.
It's,
the problem we
it's,
faced.
yeah, it's around. It's
Yeah.
not in our pockets.
Yeah.
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 So,
I find that very disturbing.
Oh, it is. Oh, trust us.
Yeah.
You're preaching to the choir.
Yeah.
That's above our pay grade, I think.
Yeah.
Well, it is, it's at the state level, they took the money for it, but it's been an issue here in Scituate, because we used to have compliance
Yeah.
checks, and probably 2 or 3 times a year, there'd be a handful of stores before
Yeah.
this board that would answer to us, and we'd
Yeah.
either hand a slap on the wrist or a penalty.
And we know that consistent compliance checks is really important. And once they kind of know that you're not around, they let their guard down. Their clerks let their guard down. And so it is something that we're very aware of. And we also know that in the places that we've done it, whatever your failure rate is doing a compliance check with like a pack of Marlboros, you can guarantee a doubling or tripling of that failure rate when you send a kid in to buy these kind of things. So that's number
You just grabbed
five,
from the-
6.
You have anything to back up that statement? I mean,
Oh yeah, we've done compliance. We have funded programs that have done compliances checks like a week before public hearing on this. And then they roll out and say, this is what our kids bought last week.
2 or 3 times the failure rate.
Yeah.
Are there is there signage for that, like I see signage for cigarettes everywhere?
No, our sign, I don't have a copy of it. Our sign just says, I think it says all
It's
tobacco
illegal
products.
to sell tobacco. I mean, the other pieces too, some of the, parents and youth say that things like this don't even look like a tobacco product. So these new products can be very confusing for retailers.
To
And
the
if they've
clerk.
done their homework on cigarettes, a 59-cent
Yeah, they know what
wine
pack of
or
cigarettes looks
strawberry.
like,
Right, this would probably not fly, but
Right.
something that's
Right.
cheap and
They-
fruity.
And that's part of the problem.
Right, and they're everywhere.
And we probably, and, you could conceivably do a compliance check just on these things, and your retailers might do a fine job.
Because the collector never had any cigars, it was always cigarettes.
That was partially.
Usually Marlboro Light.
In part because that still is the requirement. The federal government requires a sampling of compliance checks done statewide, and you can only use Newports and Marlboros on those. So,
Well, that needs to be changed.
yeah. Well, but again, it gets back to the money, where we have, at our height, we had $48 million, and we've about 4 now, so. So, that's one problem.
And we were part of one of the best collaboratives in the state, because they kept adding more people to us because we were doing something.
So that's something so the cigar packaging and size is something to contemplate. The next thing is, number 7 is blunt wraps. This is something that's very legal to do. A blunt wrap,
I think these are the only 2 I brought with me.
okay. So a blunt wrap is a sheet of reconstituted tobacco used to make joints. But, all these things, if they're sold next to tobacco, then they say, oh, no, it's not for joints, it's for tobacco, to make a cigarette. But, so watermelon, they come in fruit flavors, candy flavors, liquor flavors, chocolate. They go for 50 cents to $1 each. And 3 years ago, 2.5 years ago, Boston banned them. Boston banned them at the exact same time that they did numbers 12 and 13, but we'll get to those later. Boston banned them completely, and they got sued. It did get up to the Massachusetts Supreme Judicial Court, and Boston won. So this is a very legal thing to do. So, and it's been a success, and not only is it a success, but in general, police chiefs do like this as well, because they recognize that it's used for drugs. Our concern in tobacco is that it could be a gateway into nicotine addiction, because it is actually a tobacco product. A lot of time, this is where some clerk confusion comes into play too, is that they don't think of it as, it just says it's a wrap. And so if you're a clerk and don't know, you're like, oh, it's a watermelon wrap. I don't know, sure, I'll sell it to you.
So is that under the disguise that you're gonna roll your own cigar, so to say? As with rolling papers, you're gonna roll your own cigarette?
Right.
Okay.
Correct. But because it has tobacco, that's why we cared about it, and that's why Boston did this. So, I have a list for that too. So we have 39 cities and towns that have banned blunt wraps altogether. So it's been a success, because at least it gets us. Oddly enough, I will say, as an aside, cities and towns, unless you banned rolling papers prior to like 1989, you can't do anything about it. The state law that says no sale of plain rolling papers to minors is prohibited, and cities and towns can't go further. So that's the one thing you can't ban.
Yeah, I would think that would be contraband tobacco, which
Yeah.
tobacco.
The drug paraphernalia
Yeah.
rules are very screwy and hard to enforce.
They can see the other side of the fence with how they're advertising, but again, no
Right.
minor should be in possession of it.
Right.
Firmly.
But this
standing
bans
on
them
that.
altogether, so this does affect adults. So an adult wouldn't be able to buy a watermelon wrap either. So the next one is redemption of coupons. In the state of Massachusetts, Department of Revenue puts out periodically a list of every brand of cigarette that can be sold in Massachusetts with a minimum price. It's a minimum price for chain stores and a minimum price for non-chain stores. And so what this says is that you can't redeem a coupon that drives that price below the minimum price. A similar minimum pricing list does not exist for any of these things. It just says that you can't redeem a coupon to make these free. This, by the way, is compressed tobacco in a pill form. And snus, which is a Swedish word, are little tea bags of tobacco that you park in your mouth. And this saves, you may notice that people who use spit will spit into a water bottle or something. You don't need to spit with these. So it makes it very handy. The packaging, you spit it after an hour or
Stick
so.
it in your cheek and
Like you
swallow
spit-
your
It's
spit.
gonna generate.
Yeah.
You would spit out like you'd spit out,
Yeah.
So the fact that you don't need to spit and its packaging makes it very seductive to kids, and also that parents don't know what they're doing because it looks like a package of
Another
Tic
form of
Tacs.
it, too.
Marlboro has their own, and
I think
Camel
that's
has
been
their own.
around for years, that type of packaging, that's been around for a while.
Yeah.
The snooze has, but the packaging has transformed, I would say. I mean, I hadn't seen the Marlboro snooze until.
I never noticed, I think it was
Right.
Kodiak or
Yeah.
someone used to do a chew
Yeah.
or a dip or.
Oh yeah, they have the round tins.
They hand in the packages.
So the coupon ban would just be that you couldn't
go below the.
You couldn't,
minimum.
you couldn't make these for free, you couldn't buy them for free, you couldn't get them for free. And a lot of times, just interesting, if you see an ad nationally for some cigarette promotion in a national magazine, American Spirit seems to be the one that I see a lot. They'll say, $1 off coupon, and at the bottom it'll say, offer void in Massachusetts, and it's because of that minimum price list. Banning self-service displays and vending machines, I don't remember what you do.
We've already done that.
Yeah, that's what I figured. Roll your own machines. A couple of years ago, there were these $30,000 machines that produced a carton of cigarettes in 10 minutes for as low as, there was a place in Malden where I live, for as low as $17 or $18 for the carton. And the way you did it, in order for a retailer to get around the manufacturing requirement, I would sell her the empty tubes and the loose tobacco. She would go over to the machine, fill the top with her loose tobacco and whatever else she chose to bring in herself. And she'd use the touch screen and cigarettes. She'd reach in with her hands and pull out the cigarettes that are made in the bottom, and put them in a box or a
I've never seen one of those.
yeah.
You?
Well, you shouldn't see one
I've
now.
lived in a cave the last couple of years, because I haven't seen any of these.
Yeah, so if you,
Yeah, I know, myself included.
you shouldn't see one now.
I feel
So-
old now, I'm out of touch.
Let us know if you see one now, because what happened is last summer, it was probably Philip Morris, added a rider to the national transportation bill that banned them with the and this is during while we were trying at the state level, trying to figure out how to get rid of them. Ban them at the federal level with and put in this exception that could be read that private clubs could use it. So we have a gentleman in Winchester who's sitting on a bunch of these machines, and he's trying to open private clubs with them. So the language that we have in here does away with that federal exception, so nobody would be able to have them. It does not, by the way, ban the sale of that $30,000 machine to somebody who wants to take it home, but it doesn't also ban the smaller machine. There's little tiny machines that hand make cigarettes for your home use. There's also a machine, goes for a few $100s, that's just like the size of a microwave. So anybody can sell them, any retailer could sell it for you to take it home and do it. but this says you cannot make them in the store. So, because, the reasons for that is undercuts the pricing issue, it's a sanitary issue. There's,
I see that big time.
in Massachusetts, we have we have a requirement for fire safe filters, and these weren't using those. You don't know what the people were using, you know. In theory, the guy behind the counter wasn't supposed to be helping the person over at the machine doing whatever they're doing. So those are all the reasons that we recommend that, and I think so we have 31 that use this language, then we have some old language that this guy in Winchester was trying to use to his advantage, so we changed it. But then the next two, as I said, Boston did this the same time that, and I didn't need, and these do affect also adult sales. So what Boston said is that starting in '09, so it's been around a while, that healthcare institutions, including hospitals, clinics, and pharmacies, can't sell tobacco. And they also at the same time said educational institutions can't sell tobacco either. So that would be bookstores at universities and colleges, or convenience stores located in universities or colleges. So this, and the theory behind this was more theoretical. That, you know, if you are purporting yourself to be a healthcare provider, as CVS and Walgreens now do, you know, this is, come to us for your shingles, vaccine, and we're your trusted neighborhood pharmacist, that you shouldn't sell tobacco. And then for universities and colleges, you know, at an impressionable age, where kids have brains have not fully developed even when they're in college, to, you know, try to keep them away from nicotine addiction. So I forget the number we have for educational institutions, but it's close to this number too. So this is the sheet that lists the pharmacy one. Just it does have information on it that it's worth noting to you. So we have 69 cities and towns that have instituted this, affecting about 458 pharmacies. This does include not only independent pharmacies, but the chain pharmacies and any store that contains a pharmacy. So that's Stop and Shop. So the state actually has a nice searchable database for pharmacies, and I have that you have a CVS, a Scituate Pharmacy, and a place called Animal Pharmacy LLC. So those are the three. And so CVS, as you see, has 142 locations in the state that has had to stop selling tobacco. And independents usually, I don't know if Scituate, do you know if Scituate Pharmacy sells tobacco?
I think she doesn't because of that.
Most independents kind of got away from it years ago. So as long as the independent isn't like located within eyesight of a chain drugstore, generally they dropped it on their own because. So it's been, this is the policy that we assume Boston gets sued on, not the blunt wraps, but there's been no lawsuits, great compliance. It's been easy for chains to move their products out of the town when they need to. And we think it'll make a difference in denormalizing tobacco, so you're not putting together those, you know, kids aren't seeing tobacco in pharmacies. And also there's one small study out of New Zealand that shows that smokers who made a quit attempt, if they were using a pharmacy that sold tobacco, they were more likely, it suggested they were more likely to fail at their quit attempt, but we don't have much better than that. So that's number 12 and 13. And then 14, finding structures mirror state law. I don't know what you have currently, but state law is 100, 200, 300.
I think that's what we have.
It could be, because we did rewrite them a few years back. I think we were 50 and something, but I didn't.
Yeah, I have, I have 01 as the last. So I think first 50, second 100, third 200. So I'd recommend that they be brought to the state minimum, so just 1, 2, and 300. And then a tolling period, again.
I think those are usually the first time someone offended, I don't think we ever find them, it was usually a verbal warning.
Yeah, see, we allowed that for, you know, in the early days of the program, because we were new to this, but really, the state says minimum 100.
Yeah, it was,
minimum.
having them retrain talk to the employees, get on the
Yeah.
stick, you come before again, then
Yeah,
the fine would start, and we had one or two that we'd shut down for a week, and we usually shut them down on a school vacation.
yeah.
Kind of got the point across that,
Good, good.
but usually, like I said, first offense was usually pretty mean, just keep it perfect all the time.
Right. Yeah, we've gone away from that only because now we've been around forever.
Yeah. Understood,
So-
understood.
And the law is actually 100. So, but the law, the law is silent on suspensions, so whatever suspensions you choose are fine. You have a tolling period of 2 years, which is great, that's in the range. The longer the tolling period, the more you're holding the retailer's feet to the fire. But having a tolling period is a good thing for the business, so they know that they can someday get back to that, get back to being a clean slate. Then number 16, shall versus may. Early on in the program when tobacco was new, and this was all very new to everybody, there was a lot of, boards had may fine, may suspend, and we really have been recommending to go to the shall, and really treat it as,
The party's over.
well, I mean,
You've had your diploma.
Well, they know that-
well, yeah, I mean, we've seen it all. Boards of Health, where the retailer comes in, they're crying, they have a terrible, sad story, and they fired the clerk, and we've kind of moved away from that, partially to protect the Boards of Health, so you don't treat me differently from her in a penalty situation, but also, we really train Boards of Health now, if you're gonna do a suspension hearing, just say, did the sale take place? Yes, no. If you say no, then you need to provide to us proof that it didn't take place. And seeing that most of you have a camera going at all times, you need to show us that it didn't take place. Otherwise,
Still dealing with a small town, so we'll leave it at that, you know.
well, I know, but our end of it
I
is to
understand.
keep you
Yeah.
kosher with everybody. And even though, small town or big town, I mean, I do think that in our continually funded programs now, it's easy to just to say, with the Board of Health to say, we've been doing this for 18 years. And we're about to say the same thing, check IDs. It really hasn't changed. So,
We had a guy, what was he, in business 30 years or something, he had a first offense, and, I mean, how do you find a guy like that? I just couldn't do it. He got his warning.
well, see, yeah. Well,
That's why I say it's
but
a
I will
small
say
town.
I will say the first time though, even with $100, we have very few cities and towns that have a suspension the first time around, but the $100 fine is pretty static. But just to keep it in mind, just in case you wonder where people lay on the, what's $100 in relation to. A carton of Marlboros goes for about $95. So,
That's enough to quit right there.
I know, but it's not like he has to sell 20 cartons to make the $100 up. It's one carton would be the $100 fine. So, so that's where we're at. So that's going down the checklist.
Follow-up question to that is, you say it was $100, what is the retail buying
I have no idea.
Okay.
And it's actually,
99, it takes a whole bunch, it does take a bunch
It
of
does,
cartons to
yeah.
sell, so it's a moving target, okay.
yeah. We just know it's sold at retail. It's really hard to get the numbers, what they.
Even ballpark, I just have no idea.
It vastly is different. I mean, what Costco gets it for is different from what CVS gets it for, which is really different from what Joe's Variety over here gets it for. So it's a huge range. So that's the update as to so that's what our sample looks like and what people around the state have been doing. The two other things I remembered on my own that we've seen out there is that there are two physicians that work on the South Shore who are making it their mission to talk to boards of health about raising the minimum age. So we, very quietly, in 2005, Needham went to a minimum age of 21. And it sat there for a long time. They were the only place in the United States that had it, and it's been working. And so then Brookline Town Meeting went to 19. There was a kid initiative that wanted 19 under the theory that 19 gets it out, really gets it out of the high school. So right now we have 5 towns that have 19 and 5 towns that have 21. So it's something to ponder, but we're not pressing it hard at the state's tobacco program, but they may get in touch with you And there, one's a pediatrician, one is a, I don't think he has patients, but he's at MGH. And then lastly, so one of the problems that, one of the reasons that this has all exploded, not only the price, but because about 2 or 3 years ago, this federal government banned the sale of of cigarettes in any flavor other than plain or menthol. I picked these up, but I think these are just a colorful package, not flavored. But Camel at one time had Caribbean Breeze or something like that. So they've been forced to do this. So then we saw an explosion of all this stuff come out in response to it. And so Providence and New York City both banned flavored OTP, other tobacco products. So that's all this stuff. It's this, and it's chew, the classic chew, kind of Skoal Copenhagen. So technically, in both those cities, you can't buy any of this stuff in any flavor other than plain or menthol. It was immediately sued on in both places, in the federal government, in the federal court. It matters to us, Providence matters to us because we're in the same federal jurisdiction. Court jurisdiction is Providence. And Providence just won at the Court of Appeals level. So the only place now for the industry to go would be U.S. Supreme Court. So Providence feels good about it. We're feeling pretty good about it because we do think that, if this is something that you want to entertain, let me know, but this is probably a yellow light. But we do feel confident that the world changes for youth smoking if all this stuff was only available plain or menthol. It would make a big difference. So we shall see how that plays out. Oh, I can show you because I only had a disposable. So this is
And the indication
this
of
is
that
a
is that
this is
it
what
draws
a
kids in. That's the bottom line with the flavors.
For
and
the
everything.
flavors, yeah, well, it masks the taste of tobacco too, so it doesn't have that harsh, tobacco taste and, but yeah, the flavors and also, again, the idea that you can't break these packs apart, but currently, you can break these apart and sell them individually, so the combination of the pricing and the flavoring, I would say, yeah.
Yeah.
And I actually,
And this is a cartridge for a e-cigarette that you screw off the cartridge. And so these are replacement cartridges in Cherry
That
Crush.
holds the name
In Cherry
together.
Crush.
And
This
these
is an
are-
electronic cigarette.
that's just the chart of the numbers, which DJ was talking about.
This is high nicotine, so it probably costs a
Yeah.
little more than,
It says like 1,000, 1,200 plus. I think that was something like 5 or 10.
so you
I
got
think it was more
Such
like
a
10.
small
I think it was
commercial. How
like
many would
$10.
It's center.
yeah. So this is for a rechargeable
How long
one.
does it take to get to the filter?
So, and this comes in Cherry.
But now you can just buy the disposable cigarette for $10.
Has everything too,
E-cigarette.
people, like you're saying, make their own flavors, they cook their own flavors? And the thing that scares me with
You'd
the
fill
e-cigarettes,
this when it was empty.
Like
yeah.
you said, you can do it with the THC, so now you're adding a controlled substance into it.
Which is really our concern, and, not surprisingly.
I don't know
this-
if the exhaust, if it would have an odor to it that, or would.
Yeah,
have
don't
an
know,
odor to it.
don't know. And not surprisingly, if you go on YouTube, you can find a million ways to do
Yeah.
this. So, these are the ones that you refill on your own if you chose to. And the reason this came about was at the Northampton Board of Health. There were 3 or 4 people there who testified how they got off of cigarettes and they were using e-cigarettes, but they filled it on their own. And one woman says, I buy a bottle of nicotine and I get the flavoring, I mix it, I make praline flavor for myself, and this is how I do it. And, good for her that she's saving money. Good for her, I guess, that she's off cigarettes. But I'm thinking to myself, ooh, a 19-year-old kid would be like, off and running.
That's a tough thing, the health issue and the whole, there's, you can see someone like that enjoying it, because some of the reading I did online, it was like mixing a cocktail.
Yeah.
And somebody would sit back and enjoy a cocktail, they'd enjoy a vaporizing e-cigarette or whatever, and maybe not a bad thing.
And I will, and here's two things on that. So number one, 2 months ago, maybe just 1
I
month
say
ago.
anything gets exploited, and that's what
The
I
town of
hate.
Canton, well, that was the problem. So the town of Canton decided to ban them outright. And there was a big hearing everybody came from far and wide. They heard from every national organization. They got hundreds of emails. So they backed down, which is fine. So that's why, but we've never advocated for banning e-cigarettes. Just don't sell them to kids. Don't use them where it's smoke-free. But if you want to sit at home in your rocking chair, and this is your evening, to pound through a thing of Cherry Crush, Aces, as long as you're of age.
Right.
So, and it's because we do really have this fear. The industry is not getting in this, and people are not opening electronic cigarette stores only to serve smokers who wish to quit within 6 to 12 months. They intend to have, like Lorillard wants you to, I think, what's a Lorillard product? Newport or? Lorillard wants you to smoke their cigarettes outside and use these inside for 30 to 40 years, whatever life
I
is.
gotta ask, it really has no bearing on any decision, but the growers of tobacco, do they squeeze that and get the nicotine out? Is that why Philip Morris would be getting into it, so they can still grow the tobacco?
Unclear, unclear how they get the nicotine out. You can do it synthetically, but apparently it's very expensive. I have no clue where
How they-
big tobacco gets their tobacco
There's some
anymore.
vegetables that have it in it, I think eggplant was one.
That's why our definition says manufactured.
Right.
So anything nightshade, so tobacco, tomatoes, eggplant,
Tomatoes, those are another one, yeah.
and maybe a couple others. So that's why you say manufactured nicotine. But apparently synthetic nicotine are not there quite yet cost effectively.
What rates do you have on compliance in statewide or?
Our compliance, I don't know. I can get it to you. I don't know off the top of my head. I will say, like I said, our compliance for anything other than Newports or Marlboros probably.
When
A lot higher.
Back to my push that we want to reinstitute
Yeah.
compliance checks. How many towns are doing compliance checks and have regulations? And what is
So if
their-
you're funded, you're required to do so. I want to say we have 230, 250 cities and towns funded. And probably another 20 do them independent, unfunded towns that do them independently.
Okay.
Some of them peg their,
Sorry, go on.
some cities and towns peg their fee high enough to either get dedicated funds back to do it, or just their fee high enough so they can justify to the town that they're bringing in more money. So we now see, I would say that the average fee still hovers around $100 a year, but we have, I do have a list and I didn't bring it with me. Okay, and we probably have, the highest is 600. It was $600 a year. And one or two at 500. It was a handful of 250.
What else did we have, Jennifer, with things going on? Was hookah bars?
Yeah.
So, yeah,
Cigar bars. Was that something you're gonna bring to
I-
the presentation or something?
I can talk about that. But I
I'd
didn't,
love you to, because that was something that was brought up with our regulations.
I'm gonna look up something for you.
Yeah.
I'm not gonna play music or anything.
Intermission.
Yeah.
Now the challenge is me to do two things at once, talk and look it up.
Well, nearby, Weymouth did recently increase their permit fee and put it into a revolving account, so that way they will be doing compliance checks, and they're not just gonna do cigarettes, they're gonna do it on other tobacco products too.
Well, that's sort of where I would like to see us go.
Yeah, I think we discussed that,
Yeah.
that it would cover at least 2 compliance checks. And if they had a failure, then the fine would pay for the re-compliance.
Right.
So just to let you know, we have one.
And that kind of fine I don't have a problem with, because that's
Right.
You know.
Right.
paying for the updated check.
Right. $600 a year in Needham, $500 in Arlington, and then for like $225 to $300, we probably have about 14. We have 14 at $200, and then another 17 at $150, we have 72 at 100. I don't know what you currently charge, so that's just kind of the range.
We're probably on the, I would say we're probably on the low scale. What are we charging? 75 to 100.
I know it's low. I know we're not charging more than
Yeah, so that might be something definitely we look at in the very near future.
100. And how many,
I have you at 100.
yeah, that's what I was thinking. Then, how many independent people do you know of that do compliance checks? I mean, there are some, I'm imagining organizations that do it, but do they go outside, their geographical bounds?
Generally, the people who do them are tobacco control directors who are in funded boards of health, and they just moonlight. And so, so they would, so they've obviously are trained to do so. They have trained kids to do it. And, there would be a fee per store, or I don't know how they do it, actually. I don't know how they set it
Yeah,
up.
well,
So-
I'll use Sarah's contacts and get that information.
Right. And so they would, swoop in and do the whole town. And how many retailers do you
I
have?
think we have 13.
Right, so the secondhand smoke issue. So we have a separate regulation. It's only 4 pages long for secondhand smoke. And in one section, it says, as I said before, Scituate enforces the state law. Scituate goes beyond the state law in the following places. So the common places that we have are places that kind of extinguish the exception in the state law. And one is smoking bars. Smoking bars is the term that the state law uses for cigar bars. At the time that they passed this 9 years ago, we didn't know anything about hookah bars, but so it does capture both cigar bars and hookah bars. And hookah, just in case you don't know, it's Turkish water pipe, looks like a bong with several hoses off of it. So the way the smoking bar exception works in the state law is a prospective business or a current business goes to Department of Revenue, gives them a business plan as to how they're going to make a majority of their money off the sale of tobacco. DOR says yes, they don't, it's not a high bar. And then you would then get a letter from DOR saying, Joe's been accepted to be a smoking bar. So what we don't like about it is it's, in-house smoking. That's not great, and especially for hookah, which is very appealing to kids, number one. Number two, it kind of breaks that level playing field amongst all your restaurants and bars in the town, that all of a sudden you now have one place that can have smoking inside and the rest can't.
So when you say that, that's a liquor establishment that can have it?
They have to be very careful about what liquor they do sell, if they do sell, because they have to have at least 51, they have to prove to the DOR quarterly that at least 51% of their income comes from tobacco. And DOR has taken the permit away.
Gotcha. If the liquor sales exceed.
Yes,
the
so
tobacco
like
sales.
you'll see, I don't frequent them, but like in Boston, I think some of them have done away with liquor that's too high end, or they try to play around.
2020, here you go.
Yeah. So, and then the other problem we run into in more urban settings is that if these places are in a strip mall or in a multi-use building, then there's this smoke drifting up into other businesses, or
Yeah, ventilation to me would be a big
yeah,
problem.
yeah, it's huge. And we, this is
And there's nothing from DOR that requires it.
nothing.
So.
DOR's cares only that you're at 51%. They're not, we have to remind ourselves they're not in their jobs to do public health. They just say, they look at the piece of paper.
The problem in their revenue, that's all they care about.
That's right.
So now a hookah bar, and I say bar, I'm old fashioned about it, I mean, it's a place you go after work and blow off some steam,
Yeah.
it's not, but a hookah bar, so to say, somebody could open up just a storefront and invite people in to smoke out of this
Yeah.
hookah apparatus.
You actually may have hookah bars that don't actually have liquor.
Correct.
They're
That's
a coffee shop.
just a coffee shop, that's right, and as long as they're not selling more coffee than the tobacco,
Right.
then they can. Can you do that with cigarettes?
No, because you could never get to that level of you never make the money off of it. And in fact, hookah bars and cigar bars probably really dissuade people from using cigarettes in their establishment because they don't want you coming in and smoking a Marlboro. They need you to come in and buy a $20 cigar.
I have a problem with the whole thing personally, because the reason why I thought cigarettes and everything else were banned from public places is secondhand smoke. And you're getting secondhand smoke from a hookah pipe or a cigar.
It's the same thing.
It-
And the employees are subjected to it and the whole bit.
Correct, and I
It's just-
walked by one in Annapolis, and it was wafting right out onto the street, and like you said, you got your neighbors on either side. I just have a problem with the whole thing. If you're gonna ban cigarettes,
I
then ban it
know.
all.
It was an exception that existed,
In public.
that was put in the state law because even 9 years ago, we had cigar bars. And there was just, one of the problems is once you get a place like this, it's really hard to do anything about it, So Boston can't get rid of cigar bars. They're not taking any more applications. But they can't get, it's just really hard to get rid of them. And we had the same problem with the RYO machines. Once a store bought a $30,000 machine, Board of Health goes in and says, we want you to get rid of it. The store owner couldn't run faster to either the town manager or the mayor's office to say, here's the sales slip for the $30,000 machine I just bought. So if you don't have smoking bars, then it's a perfect time to include that ban, because then you'll never get them, and you have a level playing field, you don't ever run into this problem.
Well, that's part of it too, is a level playing field. And that came up when the restaurants were encapsulating the smoking areas and
Yeah.
everything. And we had a couple of them say, I wish the state would just ban it outright, so I don't have to compete with the town next door that allows it.
Right.
And this town semi-regulates it, you regulate it, and it's just unfair. And it was, so I agreed with them, and
No,
it sticks
and we
in my
agree.
mind to this
Yep.
day. And
So
I'm
this.
just wrestling with all this in my
Oh, yeah.
mind, and that's one that stuck out, was the secondhand smoke. That was the biggest
Yeah.
health hazard, being on the Board of Health.
So second place that we commonly see cities and towns go further is to ban smoking in retail tobacco stores or smoke shops. Do you have any?
Yeah, but I don't want it.
Okay, because what ends up happening is they don't need to get permission from you or DOR. They can just have smoking. The theory being that they want to allow customers to test fine tobacco before they buy it. But it turns into the same nightmare that you're in a multi-use building, or that there's people just staying there smoking all day, the clerk's staying behind the cash register smoking Marlboros all day, and the smoke's going everywhere. So we do recommend that if you don't have any retail tobacco stores that avail themselves of this exception, to ban smoking there too. A third common thing we see is banning smoking at outdoor dining areas. So either the ways we typically see it is wherever your liquor license extends, or wherever your food service permit extends, or wherever wait staff is, there can be no smoking. So the third one is probably the easiest to wrap people's head around, is that you're just saying you're still protecting the employee. So if it's a couple chairs outside of Starbucks that people walk in, get their own coffee, and sit outside and have a cigarette and checking their iPhone, so be it. But as soon as you introduce waitstaff into that situation, no smoking. And then,
Interesting point.
as a coastal town, we have, we now have a handful of cities and towns that ban smoking on their beaches, including Barnstable, Falmouth, Yarmouth, I think Braintree. And then we have a bunch of towns that have, lakes and stuff that have done the same thing. I will say for beaches and parks, playgrounds, things like that, we do have cities and towns that do all that. It's a nightmare to enforce, but the state does have metal signs available to put up, and generally putting up a metal sign that says no smoking gets you about 80% compliance. Smokers will see it, say, oh, put the cigarette out. Or someone will walk by a smoke and say, oh, did you see the sign? So it gets you about,
And then we'll just get the call.
I know, you will. Which is impossible because it's like, of course, the person's long gone by the time the person called you. So it doesn't matter.
Or by the time I get there.
Right. But so those are some of
The
the,
argument, is it public or private?
I should look quickly just to make sure I'm getting them all. Yes, so, but these are just places that the state, that the state allowed for hotels, hotel motel rooms. Boston has banned smoking in all hotel motel rooms completely. I'm looking at, I have a checklist on the front
What's
page
that
of
hotel
this.
here in the harbor? They allow smoking in any of
I
the?
have no idea.
It's so small, I would think no, but.
Then the last one really, I would not recommend doing unless it's been a problem for you, is private clubs. I don't know if you have smoking in private clubs.
We've got DFW, I think, the only thing that
If everybody's living peacefully, you may want to leave it alone, or you can even ask the VFW if they'd be interested in letting you ban it, because sometimes they have a fight amongst themselves as to what to do, and sometimes they don't mind the
I
town
don't
coming
think
in.
they're there yet.
Okay, very good. We have had
I would-
veterans clubs walk up to boards of health and say, we can't solve this amongst ourselves. If you do something better, we'll live with it. You know, but if they're living at peace with your restaurant community, okay.
Yeah, it's a pretty limited clientele there.
Well, what I think the problem that, these places that had the problem inside, what they were running into is that an equal amount of members
Yeah.
couldn't use it because they are on oxygen, you know, themselves, or something, some other respiratory problem. So they feel like they couldn't use their own club anymore.
Oh, well, that's a good point.
Yeah, so, but,
Uh,
but if you're interested in updating the sales reg, I can also, and I can get you I can send you the ETS one and you can pass it out. And it has the same kind of checklist on the cover.
Good. Yeah, yeah. Well, I think this has been pretty comprehensive, and I think you guys have a little homework to do. But I think it's pretty simple from what they lay out. We just do the checklist and agree.
In all fairness, and you might not like this, but is there someone from the other side we should ask?
Well,
Why? Because we have always looked at it from two sides, and right now, and don't get me wrong,
No.
you did a great presentation, but should the other side come in and speak? Should
You
we
will.
invite somebody in?
At the public hearing, if you have a public hearing, they will come.
Yeah, but this is an informal meeting, and
I
to
can
me,
tell-
whether,
I'm
well,
okay
it's a
to-
public meeting, yes, but,
I'm okay telling you the other side if you
Yeah.
want me to.
well, no, I just, to have them at least, I'd like to hear the health issues or not, or the other side
Well,
of the argument.
that's the point of the public hearing.
Right.
What we want to give them is some concrete language that they can actually make concrete comments on. Right now, we're discussing concepts,
Right.
and we're not discussing, things that you can necessarily base a case or something on. And they would they would have to come back again anyway for the public hearing anyway.
Right, to
Because
vote on it.
because that's where the testimony becomes official.
Just trying to be fair, that's all, that's all.
Yeah, well, you're fair by holding the public meeting. That's why we have to hold it.
Right.
That's why we,
But if you, well, I don't know, that's what I'm trying to think, if you reached out to one tobacco company, or you reached out to a tobacco store, or somebody that would come in and just give a little bit of their side, and then I don't know how, if you were invited by Jennifer or not. I just, like I say, you try to be fair, whatever your decision is. When you're done at the end of the day, you took every information in from all sides, whether it's right or wrong, At least you gave everybody a fair shot. Like I say, some things you showed me scare me, but who knows, if somebody's got an argument the other way, that's all. And I try to play as fair as always with everything. And you brought a lot of stuff to light to me. So that's all. I'm just trying to lay it out there. I hate to rush into anything, and I think everything here is good. I don't know if anybody else agrees with me or not. Maybe I'm just shooting from the wrong side of the hip.
I mean, I would say you have a small enough retailer base that you can probably send them a quick note, or if you have them on email, just send them a quick email about the upcoming hearing so they all know what's happening.
Oh, well, I would send them, I would do more than that. I would send them a letter and probably tell them that, if we get to the point of draft regulations that the board's happy with, they will put it up on the website, and they
Yeah.
could certainly have access to it that way.
Yeah.
Because now we only have to do the summary, in the public notice, which doesn't give them all the specific language.
Right.
But we would certainly, you know, and they could also come to town hall, we give them a hard copy if they wanted.
Yeah, very good.
I mean, you know, I want them to know about this.
But
you
that's
know.
also the current tobacco retailers, as opposed to somebody, an alternative provider.
Well, I imagine most of them would if they get to
Would be
the
first in line.
they would contact their contact with the tobacco company. And if the tobacco company wants to come in on the hearing, they certainly can too. There's nothing that would stop them. I mean, that's the way it works usually. I mean, that's the way it worked the last time, when we first started
I
this.
just think other things we've done with the fluoride and the different things we've done in the past that you look at it from all sides. And it's just, it's good for an argument, it's good for a debate. It's only fair, you know? So. But I definitely see some changes at this point that I'm interested in exploring.
Yeah.
You know,
Absolutely.
without a question, you brought a lot of things to light.
Yeah,
No question about it.
you'd be in favor of trying to get a town meeting article to establish the revolving account fund so that we can pay for the compliance checks again?
Not for November, would it be for November or for,
No, it's never gonna be November.
yeah, no, absolutely, absolutely.
Do you have Weymouth's language? Oh, can you get it?
Oh, I think I came up with the language.
Okay,
already.
okay, very good.
She just
No, I
didn't-
absolutely, I
forward
would
on it.
pursue that,
They didn't
absolutely.
forward on it.
That's been a bone of contention since they took that money away. It was terrible. I thought it was a very positive
It's
program.
the best, yeah.
Yeah, it was.
Some of the guys weren't happy with some of our decisions, but again, that's, kept an eye on our own, that's all. Like I said, it's a small town and we,
Yeah, I'm very concerned because, you know, we now have the program Scituate Facts, which is substance abuse. And, you know, this is just one small part of it, of delaying it for children, that, you know, let's not get you down the wrong path. Get you tempted by something that could get worse.
If they're not already using these for. But I think DJ was about to say too, that you will get feedback from the other side. You know, the second you put a notice up about this and say it's going to hearing, you will get notices from the
I can
opposition.
envision it right away because,
Yeah.
you know,
It's the cigar, the cigar and the coupons, the two that spark
I can
interest.
envision it right away that, you know, a retailer, you know, is saying, okay, you guys are gonna take all these away from me, and they're gonna go 5 minutes to NOLA. And, you know, that might hurt their business. You know, the kids may come in, or whomever may come in and buy that and buy whatever else, either a lottery ticket or a bottle of Gatorade or whatever it may be. I can see that happening.
well, that comes down to that level playing field. there.
Almost immediately, you know what I mean?
This is the
Especially because-
grassroots here.
Especially because, you know, Norwell Center's 5 minutes away, you know what I mean? So I can see that happening.
Well,
It's
if
a-
they want
we
to,
live-
if they want to break the law, no.
Well,
Yeah, yeah, I mean,
we
you-
live through this with restaurants.
Yeah.
Yeah.
That's right, with the
Right.
smoking man, it comes down to the level playing field.
And
but
people
it-
didn't
You
go.
had to start
People
somewhere.
didn't leave to go to those towns to smoke at
Yeah, I
restaurants.
mean, a lot of, we had with some restaurants, they increased business.
But it is the problem of doing this locally.
Right.
But we probably will never, with the exception of the state, dealing with no sale of e-cigarettes to minors, the state's doesn't do a whole lot on sales stuff. They're merged in secondhand smoke stuff or, and the Attorney General's way up there.
Well, some of it is, you can see the way around it, but you know it's obviously for something else, but yeah, you know, that's the,
Yeah.
I'm old school, I don't know.
Well, yeah, I mean, it is, and, you know, I recognize too that, you know, Philly blunts have been in some, I mean, been flavored for 10 years, you know, for 20, 30 years.
30 years, yeah.
You know, but the term blunt wrap actually comes from Philly blunts, because you score down this size, you strip it, take it out, mix it with pot, put it back together. And that's where the term blunt comes from, so if you see a kid that has a t-shirt that says like, I love blunts, I love me blunts, then I'm talking about Philly blunts.
The rap industry was really glorified it, so, you know.
And yeah, so this made it easier.
Right.
It is.
Yeah, now you just buy the wrapper.
Right.
Right.
So.
Well, thank you very much.
You're very welcome.
Is there any other questions or anything?
No.
I do, yes.
So I do appreciate you taking the time.
And I'm on like every list, you know.
Do appreciate your time, and you can probably
Yes,
put a
thank you so much. I
well-put-together
really-
presentation.
This was really good information to have.
Yes, excellent.
It's very helpful to see what other towns are doing too.
Yeah, I mean, I think that's one of the things that, you know, it gives comfort for us to see what other cities and towns do. And to, you know, we're very honest about we do not want to see you in court. I don't want to get a call from your town administrator. So we're very aware that, you know, I give you what's happened and as best as possible, and so far.
If something comes up, or somebody does come in maybe in the next 2 weeks, we'll let you know, so if you want to be in the audience,
Okay.
Or you could just catch it on YouTube.
be part of that discussion on debate, you know, that's absolutely. You open the door, and now that's
Yeah.
the way I feel comfortable about it. It's
Is
only
the
way.
FDA, are they testing the vapor that people are exhaling? It's kind of the same way, you know, when it's secondhand smoke, or is it still in its
I have no
infancy?
clue what they're doing, frankly. But I think I think their first step is they tried to categorize these as medical devices and ban them from being imported in the United States. This is when practically every e-cigarette was made overseas. And they got shot down in court. They couldn't do that. So I think their effort now is to treat them like tobacco. But until they know how to classify them, I don't think they're doing anything else. And so they go at a glacial pace at the federal government level on tobacco. Because everything ends up in a lawsuit.
Well,
Everything.
Well,
you know.
because tobacco's the second biggest lobby in the
Right.
country. so-
And, you know, when they make a decision, it affects a lot more than your 13 retailers. And so, you know, and then at the state level, you know, it takes an average bill 7 years to become a law. So, you know, we don't see things zip at the state level either.
Unless it's fluffing or something.
Right. Well, yeah, yes. Unless there's some crisis and they need a response to the crisis, but other than that, it goes at their usual pace. So, I mean, I will say, I mean, I know that there's this push-pull between, you know, towns say, why doesn't the state do it? And the state says, why don't towns do it? But we do, you know, historically, we've had much better success at the local level.
Of course.
We wouldn't have had a statewide smoke-free law if it wasn't for cities and towns going through the pain and agony of two-hour-long hearings on smoke-free
Yeah,
restaurants.
and then when we finally got Menino indicated, then the whole state, right?
Yep. So,
Thanks again.
Interesting.
you're welcome.
Thank you so
Thank
much.
you very much.
Well, look it over, see what you think. We don't really know a meeting date yet. I'll try and check that out and see what's available tomorrow on the calendar. And then I will email you, see what your availabilities are. I don't think it's gonna be a two-nighter town meeting. I hope so.
The only thing to be cautious with is
Do we have anything right now pressing on the agenda? Is there any septics that are on the desk? Is there anything?
No.
I mean, can we
I've
just-
got two plans that came in I haven't looked at yet. I've got some are waiting for corrections.
Is there anything at the town meeting that is,
Public health ones?
issues?
Not that I know, because I haven't been in, and a lot of it's housekeeping, and we count some of the town-wide issues, like the brown water, the library, I'm not sure if the public buildings proposal is gonna be that, or it's gonna be moved to the spring.
Well, just looking at it, where town meeting's on a Monday, which is our regular meeting night, we probably wouldn't do anything till Wednesday, which would be a week and a half. You're gonna be busy that week anyways. You wanna just have the meeting and
No, I'm not gonna be doing
not with preparing stuff, or just looking at having a meeting in a month instead of having it in 2.5 weeks and then meeting again in a week and a half.
Well, it's up to you. Go with your direction. I mean,
Well, that's why I was asking, is there anything
I mean,
pressing
I
that,
don't-
where you wanna jam a meeting in between and then having another quick one? Or just cancel the one in the middle and go out a month?
Well, we could go out a month unless something rears its head.
Well, then why don't we do that then? That works for me.
Tentatively, I may not be around the 18th. That is Monday the 18th. So if you want to take that.
Well, we'll go back and look at that, if it's the 18th or thereabouts, look at that and see.
Well, what's the fourth?
I'll do what I was
Fourth
gonna
and the
do
20
anyway.
Yeah.
I'll go and
Yeah.
see what the availability is. I'll check with Tricia and make sure it's a one-nighter
Yeah.
or a two-nighter.
But
It's
I
probably
think,
gonna be just one night.
I think
If it
Russell
goes
makes a
2
good
nights,
point.
it'll go Wednesday night, I'm gonna schedule it, most likely it's 12 articles, most likely.
Oh, that should be one-nighter, yeah. Yeah, okay, well, it's a one night. So we could, I'll look at Wednesday, because we're already late Tuesday and people meet here Tuesday usually.
Well, then,
But there's no reason why, if we don't have anything, we don't cancel it. However, I would like you to go through that checklist and get back to me as to how you feel about it. You know, if you would just want to use the numbers and tell me which numbers you like.
I circled most of them. The only questions I really have are on the e-cigarettes, that whole nicotine.
Well, there's some language in what he gave you, so read that might help you.
I mean, my
It's the
focus-
delivery, it's the nicotine, the age I can definitely.
Yeah, my
Minor
focus,
thing.
my focus is on the minors. I
Well,
think.
that's what.
Because you could always put it in place at 18, and then you really then could go 19, 20, 21 if you wanted, right? So, and I think that, to me, that's the biggest concern, is to deal with the minor issue. And then,
Exactly, that's where that's what I'm thinking.
I mean, I think we should limit the numbers. I mean, my quick feedback is I think we should limit the number of establishments. We can start there, you know, and that at least wraps, you know,
Yeah, no hookah, no.
well, puts a
cigar
control
bar.
on it. I mean, I think 13 for our population is certainly fine. And then we focus on the minor stuff. I mean, that's, you know, and we can do other things that that's my quick feedback is, that's that's how I would prioritize.
Well, I would like to do the hookah bars and the cigar bars because of the ventilation issues in the public's.
I have no interest in those in town. I think
Those-
they're a health issue.
And
all
he's-
around.
You know, the way he explained it was if you put it in right away,
Yeah.
they'll never come here as opposed to trying to get one out or regulating the one that's already in.
Yeah.
in
I know some towns have also, you know, banned smoking in their public housing, but I'm not ready to go there yet. I think we need to address the minors and the other things that are public health risks. Because it's the ventilation and the smoking atmosphere again, which is the secondhand smoking.
Secondhand
With-
smoke,
with
that-
those two things again.
That's-
So, you know, that's where I would like to see us focus, but I mean,
And we can
you
always
are the
put it
board.
in
You
place,
have to-
and if we, you know, the amendments could be made to it, some tweaking, or, you know, some changes could be made to it, but you do need it in place. I'm a big fan of putting something in place that then it can be,
Yeah,
if the need arises, you can change.
yeah,
I agree.
yeah, okay, so look at those numbers, it should be pretty, I mean, you could do it one way, you can either give me the ones you're in favor of, or give me the numbers, if it's smaller number, give me the ones you're not in favor of.
Right.
So, just to give me an idea of, you know, where to go from here, okay? And I will try and get back to you, I'll email you all tomorrow on availability, just in case we need it.
I was even gonna suggest the 11th for a meeting date, but that, again, we need meeting space because conservation.
That's
We can
Veterans
get it
Day.
because it's a holiday.
Oh, that's another holiday, Veterans Day.
Yeah, I'm thinking we should just go
Okay,
Well,
well,
let's
if you two will agree to be here, that's fine. If Steve can
Well, the
come,
18th is,
he can come.
right.
All right, let's look into that. Let's just look through that.
On the schedule that I had, it's the 4th to 25th. That's why I did what I was gonna do, the
Oh,
18th.
okay.
So
Oh, well, let me look.
that's what was on the schedule.
It may be that we changed it because of the holiday,
Okay.
and because Concom needs a date too.
If need be, it's not wrong. Just, I can read it. I'll make sure.
All right, well, I'll verify that all, I'll email you tomorrow.
Anything else?
I think that's it, no new business, we're all good.
All right, make a motion to adjourn.
Second.
All those in favor?
Aye.
Aye.